Can you describe your experience working with elderly patients or residents in a care home or similar setting?
Certainly, my experience in elderly care has been both extensive and deeply rewarding. For the past 3 years, I have been actively involved in providing nursing care to elderly individuals in a residential care facility in my community. During this time, I've had the opportunity to work with residents presenting a diverse range of needs, from those requiring minimal assistance to individuals with complex medical conditions and cognitive impairments. My responsibilities have included comprehensive health assessments, medication administration, wound care, and collaborating with interdisciplinary teams to develop and implement individualized care plans. I have found it particularly fulfilling to build strong relationships with residents and their families, offering not only clinical expertise but also compassionate support during what can be a vulnerable stage of their lives. This experience has solidified my commitment to geriatric nursing and instilled in me a deep appreciation for the unique challenges and joys of caring for older adults.
How do you manage medication administration for multiple residents, ensuring accuracy and timeliness?
Medication administration for multiple residents requires a highly systematic and meticulous approach to guarantee both accuracy and timeliness. My strategy revolves around a robust system of double-checking and organization. Prior to each medication pass, I meticulously review the medication administration record, mark against the physician's orders, ensuring correct dosages, routes, and times are verified. I prepare medications for each resident individually, using medication carts and clearly labeled containers to prevent any mix-ups. Throughout the administration process, I adhere to the rights of medication administration, consistently confirming the right patient, right medication, right dose, right route, right time, and right documentation. Furthermore, I prioritize timely administration by adhering to a structured schedule and proactively anticipating potential delays. Post-administration, I promptly document each medication given on the MAR, noting any deviations or observations. In situations where discrepancies arise or residents express concerns, I immediately investigate and report to the appropriate healthcare provider to ensure resident safety and maintain medication integrity. This systematic approach, combined with unwavering attention to detail, allows me to manage medication administration effectively and safely for multiple residents.
What steps would you take if a resident showed signs of a sudden health decline, such as shortness of breath or chest pain?
In the event a resident exhibits signs of a sudden health decline, such as shortness of breath or chest pain, my immediate priority is to assess the situation swiftly and act decisively. My first step would be to conduct a rapid but thorough assessment of the resident, beginning with vital signs, including oxygen saturation, heart rate, blood pressure, and respiratory rate, alongside a focused respiratory and cardiovascular assessment. Simultaneously, I would ensure the resident is in a comfortable position, typically semi-Fowler's or high Fowler's to aid breathing, and administer oxygen if indicated and prescribed, while alerting a colleague for assistance. Crucially, I would promptly notify the registered nurse or the physician on call with a concise and accurate report of my findings, including the onset, duration, and severity of the symptoms, along with the resident's baseline condition. While awaiting further instructions, I would continue to closely monitor the resident's vital signs and overall condition, providing reassurance and emotional support to both the resident and any concerned family members. Depending on the physician's orders, I would prepare to administer emergency medications, initiate further investigations, or arrange for transfer to a higher level of care, all the while maintaining clear and consistent communication with the healthcare team to ensure the resident receives prompt and appropriate medical attention.
How do you handle wound care or pressure ulcer prevention in immobile residents?
Wound care and pressure ulcer prevention in immobile residents demand a proactive and multifaceted approach centered on meticulous skin assessment and preventative measures. My strategy begins with regularly and systematically assessing the skin of immobile residents, paying particular attention to pressure points such as heels, sacrum, hips, and elbows, using validated risk assessment tools like the Braden scale. Based on the assessment, I develop individualized care plans that prioritize pressure relief through frequent repositioning, at least every 2 hours, or more often as needed, using appropriate support surfaces like pressure redistributing mattresses and cushions. Furthermore, I emphasize maintaining skin hygiene through gentle cleansing with mild cleansers and ensuring the skin is thoroughly dried after washing. Moisturizing skin with appropriate emollients is also a key component, helping to maintain skin integrity and prevent dryness and breakdown. For residents who are incontinent, diligent incontinence care is essential to prevent moisture-associated skin damage. When wound care is required, I follow established protocols for wound cleansing, dressing selection, and ongoing assessment of wound healing, consulting with wound care specialists when necessary. Education of both residents and care staff regarding pressure ulcer prevention strategies is also vital, fostering a collaborative and proactive environment focused on maintaining skin health and promoting comfort.
Can you explain your experience with managing chronic conditions common in elderly residents, such as diabetes, dementia, or hypertension?
My experience in managing chronic conditions prevalent among elderly residents, such as diabetes, dementia, and hypertension, has been substantial and encompasses both pharmacological and non-pharmacological interventions. Regarding diabetes management, I am proficient in monitoring blood glucose levels, administering insulin and oral hypoglycemic agents, and educating residents and staff on dietary management and lifestyle modifications to optimize glycemic control. For residents with dementia, my approach is centered on person-centered care, employing strategies such as cognitive stimulation activities, environmental modifications to enhance safety and reduce agitation, and behavioral management techniques to address challenging behaviors. Medication management for dementia often involves careful consideration of potential side effects and interactions, requiring close collaboration with the physician and family. In managing hypertension, I am experienced in monitoring blood pressure trends, administering antihypertensive medications, and educating residents on lifestyle modifications such as dietary sodium reduction and regular exercise, as appropriate for their functional level. Across all chronic conditions, my approach is holistic, involving regular assessment and monitoring, individualized care planning, medication management, patient and family education, and collaboration with interdisciplinary teams to optimize resident well-being and quality of life while effectively managing their chronic health conditions.
How do you build trust and rapport with residents who may be hesitant or resistant to care?
Building trust and rapport with residents who may be hesitant or resistant to care is paramount to providing effective and compassionate nursing. My approach prioritizes establishing a genuine connection based on respect, empathy, and patience. Initially, I focus on active listening, truly hearing and acknowledging their concerns and anxieties without interruption or judgment. Using clear, simple language and avoiding medical jargon is crucial, ensuring they understand the purpose and benefits of the care being offered. I strive to approach residents in a calm and unhurried manner, allowing them to express themselves fully and feel heard. Respecting their personal space and preferences is fundamental, as is consistently demonstrating empathy and understanding for their individual situations. Where resistance is encountered, I avoid confrontation and instead try to understand the underlying reasons for their hesitancy, which may stem from fear, discomfort, or feelings of loss of control. Offering choices whenever possible and involving them in care decisions can significantly enhance their sense of autonomy and cooperation. Building trust is an ongoing process, requiring consistency, reliability, and a genuine commitment to treating each resident as an individual with unique needs and perspectives.
How would you handle a situation where a resident becomes agitated or confused due to dementia?
When a resident with dementia becomes agitated or confused, my primary focus is to ensure their safety and de-escalate the situation with calm and empathetic interventions. My first step is to assess the potential triggers for their agitation, which could include environmental factors like noise or overstimulation, unmet needs such as pain or hunger, or even internal factors like anxiety or disorientation. I approach the resident in a calm and non-threatening manner, using a gentle tone of voice and maintaining eye contact at their level. Speaking slowly and clearly, using simple language and short sentences, helps to reduce confusion. Creating a calm and quiet environment by reducing noise and distractions is often beneficial. Redirection is a key strategy, attempting to gently redirect their attention to a more calming activity or topic, such as looking at photographs or listening to soothing music. If verbal de-escalation is not effective, nonverbal techniques like offering a comforting touch, if the resident is receptive, or simply remaining present and calmly reassuring can be helpful. It's crucial to avoid arguing or correcting the resident, as this can escalate their agitation. Throughout the episode, I continuously monitor the resident's safety and well-being, and if the agitation persists or escalates, I would seek guidance from the registered nurse or physician to consider further interventions, such as medication or environmental adjustments, always prioritizing the resident's comfort and safety.
Can you give an example of how you've provided emotional support to a resident or their family during a difficult time?
One instance that stands out in my mind regarding emotional support involved a resident named Mihiraa, who was nearing the end of her life. Her family was understandably distressed and spending considerable time at the care home. I made it a point to regularly check in with both Mihiraa and her family, not just to provide clinical care, but also to offer a listening ear and a compassionate presence. I spent time simply sitting with Mihiraa, holding her hand and speaking softly to her, even when she was no longer verbally responsive, believing in the power of presence and touch. With her family, I made myself available to answer their questions, no matter how small, and to provide honest and empathetic updates about Mihiraa's condition. I also facilitated communication between the family and the physician, ensuring they felt informed and involved in decision-making. Recognizing their grief and emotional exhaustion, I offered practical support, such as providing refreshments and ensuring they had a comfortable space to rest within the care home. Following Mihiraa's passing, I reached out to the family to express my condolences and offer resources for bereavement support. This experience underscored for me the profound impact nurses can have by providing not just physical care, but also unwavering emotional support to residents and their families during vulnerable and challenging times.
How do you ensure residents feel respected and maintain their dignity while receiving personal care?
Ensuring residents feel respected and maintain their dignity while receiving personal care is at the heart of my nursing practice. I firmly believe in person-centered care, which means prioritizing each resident's individual needs, preferences, and values in every interaction. When providing personal care, such as bathing, dressing, or toileting, I always ensure privacy by closing doors and using screens as needed, respecting their modesty and creating a private space. I communicate clearly and respectfully, explaining each step of the care process and seeking their consent before proceeding, offering choices whenever possible, such as the time of care, clothing options, or bathing preferences. Throughout the care process, I maintain a calm and professional demeanor, avoiding rushed or impersonal actions. Addressing residents by their preferred names and engaging in meaningful conversation during personal care fosters a sense of connection and respect. Being mindful of cultural and personal sensitivities is also crucial. Most importantly, I strive to treat each resident as I would want my own family member to be treated, with kindness, compassion, and unwavering respect for their individuality and inherent dignity.
How would you communicate with a resident who has hearing or speech difficulties?
Communicating effectively with residents who have hearing or speech difficulties requires patience, adaptability, and a multisensory approach. For residents with hearing impairments, I first ensure I have their attention before speaking, positioning myself directly in front of them at eye level to facilitate lip reading and visual cues. Speaking clearly and slightly slower than normal, without shouting, is essential, and I make sure to minimize background noise that could interfere with comprehension. Using visual aids such as written notes, pictures, or gestures can significantly enhance understanding. For residents with speech difficulties, I encourage them to communicate in whatever way is easiest for them, whether through gestures, writing, or assistive communication devices. I allow ample time for them to express themselves without interruption and practice active listening, paying close attention to nonverbal cues and body language to aid comprehension. Asking closed-ended questions that require simple yes or no answers can be helpful, and repeating back what I understand to confirm accuracy is crucial. In both situations, patience and empathy are paramount, creating a supportive and non-judgmental environment that encourages communication and ensures residents feel understood and valued, regardless of their communication challenges.